हाँ जी।
Rahul, please go live. Click go
मैं
live.
हाँ वहाँ में हाँ मासिन कर रहा हूँ।
Good afternoon, ladies and gentlemen, my distinguished panelists, and all the viewers. I'm Dr. Nishant Sharma. Welcome back to another episode on this series of virtual discussion for Arthritis in India, a nation by dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we talk about the different spaces of arthritis, its management strategies, the difference in prevalence, and more importantly, about patient education and awareness and certain measures of prevention. So, to discuss today's panel, I have a few very experts from the field. We have Dr. Devendra Kumar Taneja, Medical Director and Senior Consultant, Orthopaedics, Arihant Hospital and Research Center, Indore. Good evening, Dr. Taneja. Thank you for joining.
Good evening.
Yes. And we'll be having Dr. V.K. Gupta, who's an orthopedic surgeon at Dr. V.K. Gupta Hospital, Agra, joining us shortly. So, Dr. Taneja, while we set the particular tone and introduction of this conversation, please educate our audience about what is arthritis and what are some common types of arthritis that are very prevalent to the Indian population, please.
Thank you, Nishant. See, since this whole program is for our general public to cause an awareness about this condition, everybody should understand arthritis means any inflammation of the joint. Okay. So if there is a joint and there is an inflammation, whatever may be the cause of that inflammation, causes pain, it will cause swelling, it will cause difficulty in walking. So, in most of the cases, the most common arthritis in our country is the degenerative arthritis, which means the cartilage inside, which is the main cushion of the joint, which is helpful for you to walk, which have no nerve endings, and you do not get any pain, which is the commonest thing. And as the age advances, the most of the people around 50 above start getting these degenerative changes. This is what we call as an osteoarthritis of the joint. The other problem is the very common problem is a rheumatoid arthritis, which in layman they call as a गठिया बात की बीमारी हो गई है. Now this is basically an autoimmune problem, and autoimmune problem means that your inner defense mechanism, something goes wrong, and that itself causes damage to your joint. So as a result of that, there is again an inflammation, again a damage to the cartilage, and you start getting a pain. And the third very important arthritis, as we all know, it is a metabolic cause. For example, gout. Now, gout is because of the purine metabolism or protein metabolism, and they start getting pain in the joints. So these and there are other joints, reactive arthritis or infective arthritis, or because of the some skin condition like psoriasis. There are so many types of arthritis. The most important arthritis by which an individual gets really perturbed is the osteoarthritis, the rheumatoid arthritis, and sometimes they get an gouty arthritis. And we have to look into this thing. Yeah.
Thank you, Dr. Taneja, for setting the introduction. Now, talking about the common signs and symptoms that you have seen and you would like to educate, and also talk about some key risk factors that are associated with developing arthritis.
Yeah. You see, let us take a patient who is developing an arthritis. As I was told you, whatever may be the cause, it is basically the inflammation that starts in the joint. Once there is the inflammation in the joint, they start getting pain. This pain may get aggravated by activity, or sometimes when they are sitting, they say we try to get up, or we try to commute to the stairs, or we're coming down, we start getting pain. And this pain gradually goes on increasing as the damage becomes this thing. The second important thing is a swelling, because when there is a inflammation, what tissue will get inflamed? The tissue get inflamed would be the most important, is that membrane which secretes the liquid, which is like a oil in the joint, what we in our jargon call as a synovial fluid. That membrane gets inflamed. So once they get inflamed, they throw more of the synovial fluid, which gives rise to a swelling. So inflammation, then the swelling because of the inflammation of the synovial membrane, then more excretion of the synovial fluid that gives rise to this thing. Then there is the associated inflammation around the muscles around this thing. Now all these things leads to the second symptom, and that is the stiffness in the joint. Because and then third thing relates to the restriction in the movements of the joint. So they find they cannot walk about this thing. Then the next stage they come, they say, sir, we cannot walk too long, we can't run, we can't do any jogging, and this becomes. And later on, start getting as the disease advances, they start getting the deformity of the joint, and which still becomes very disabling. So these are the symptoms, which is and why do they take place? Very simple thing. The whole process starts with the inflammation of the joint, and the next thing is which gets attacked is the synovium, and the next stage which gets attacked is the articular cartilage. Now, as we have told you, the articular cartilage is the important part in whole of the joint, which covers the ends of the bones of both the bones, and these articular cartilage has no nerve ending, and because of something which now there are a lot of research going on, and there's some enzyme which triggers this process of degeneration, and that is because of that there is the joint start fragmentation of the articular cartilage, then whole articular cartilage get exposed, then underlying bone is opened up, there are nerve endings at the subchondral area, and that is the bone above and bone below start touching each other, and then they rub each other, they start getting too much of pain. So the pain can be mechanical, pain can be because of the inflammation, and this is a very important reason that patient gets they want to get rid of this pain. They say, I'm not bothered about my deformity, but I must get rid of this pain. So one should try to keep their joints as healthy as this thing about which we can talk later.
Right. Thank you, Dr. Taneja, for that. Talking about some key risk factors, like I had mentioned, please talk about some key risk factors that are associated with this condition, please.
Yeah, they see the most important risk factor in these patients. Why some people get early osteoarthritis, some people don't get early osteoarthritis. Number one, those people who are very obese, who had some illness earlier, whose immune system is not very good, patient having a diabetes, patient having a lot of consumption of alcohol. Now, these are some of the factors, or patients who are doing lot of high impact exercising. For example, there's too much of jumping, too much of running, too much of jogging, and they keep doing it in a younger age. It has a lot of impact factor onto this thing, and this will give rise to the damage to the articular cartilage. So one should try to avoid this thing, and thereby you can avoid an early onset of a disease, which is very, very important. Otherwise, as the disease will advance, this arthritis will also advance. Yeah.
Right. Thank you, Dr. Taneja. So while that we create this awareness and patient education, I want you to emphasize the importance of early diagnosis in cases of arthritis, and how do you feel that it affects the overall treatment outcome that you see as a clinician, please?
Very right. You see, the number one, all the it is our duty of all the health professional to try and make the people aware that if you have any of these symptoms, immediately see your doctor. Now, one of the earliest way how you can diagnose these things, we have got the very first common thing is we take an X-ray. There are a lot of serological tests. There are a lot of biochemical tests. By you can always make an early diagnosis. For example, you have a patient of say osteoarthritis. So in the early stages, when you take an X-ray, you find there is hardly anything. But as you repeat the X-ray every, say, 6 months, you will find the joint space is getting this thing. So you can warn the patient that, look, here is it. You are a case where your osteoarthritis has set in. For example, you take a patient of a rheumatoid arthritis. Now we do a lot of serological and biochemical tests, but in the early stages, these tests may be negative. Even with a patient who is a positive case of rheumatoid arthritis, you know that in about 50% of the cases, rheumatoid factor may be false negative or a false positive. Will not tell you. So one of the earliest way to diagnose rheumatoid arthritis, which I very commonly use, is to either to take an oblique view of the both the hand, what we call as a cup holding position, or you take these days the MRI of the both hand, and you can easily see a subchondral erosion in the metacarpal hand. Now, if you find a subchondral erosion in the metacarpal hand, it is a very diagnostic of a patient who is going to get a rheumatoid arthritis. There are also many other conditions who mimic like a case of a rheumatoid. Now, patient who comes to you within a, say, sir, I got only pain in the first metatarsophalangeal joint. I got a swelling. Now, these are the patients, and if you ask them, taken a history, that these are the patients who has been taking a very high protein, and especially the red meat taken this thing, and you just get an investigation done, get in a simple uric acid test, and you find the uric acid is very high. And luckily, we have got very good medicine these days which can bring down the uric acid very well. So once you make an early diagnosis, obviously you can advise the patient accordingly that okay, how you can prevent the further deterioration of this thing in osteoarthritis, the lifestyle modification, in rheumatoid arthritis, the use of certain very important drug, and in gout, the change in the dietary system, and giving that medicine will have a in a long term, a very good impact on the overall improvement of their condition. So early diagnosis in why this thing is extremely important. But in India, the patient comes so late to us, and they hold both the legs are in big virus, and they just keep walking. सर हम तो चल रहे हैं, हमको कोई तकलीफ नहीं है, अभी
Right.
बहुत तकलीफ हो गया, इसलिए हम आपके पास आए हैं कि कुछ
Uh,
कर दीजिए. अरे भाई इतना लेट कर दिया, पहले आते तो कुछ कर देते आपको. So that is how we have to be very very conscious and telling the patient to get themselves diagnosed as early as possible.
Thank you, Dr. Taneja, for that answer. We will talk about how can we improve patient education more while we go down this particular session. Now, as we know that arthritis requires a multidisciplinary approach. So I want you to shed some light on the importance that you feel multidisciplinary approach holds, including the collaboration between orthopedists, orthopedic surgeons, physiotherapists, occupational therapists, rheumatologists for that fact. And how do you feel that this approach benefits a patient overall?
Well, this is a very important aspect of treating any condition. You see, it is just not our arthritis. You take any condition, you take cardiac condition, you take respiratory condition, all condition, doctor is one person in whole of the leg. Osteoarthritis, you have a very important role of the physiotherapist. Very, very important role. They have got more problem, you have to send the patient to the occupational therapist. Very important. Third, rheumatoid arthritis is now a very well established rheumatology, a very well established branch. I remember earlier when we to treat the whole rheumatoid arthritis ourselves, start giving them medicine. But these days also biologics have come, other advances have come. So we try to refer them to them, and they give those medicine, they become all right. So then not only this thing, you need to have a psychologist. They sometimes get into a lot of depression. You need to have a psychiatric patient. So all these things when they join together and work for the patient, the overall benefits are extremely good. So one should always be ready if you are not able to diagnose, because you see, it is a well said in our science of medicine: correct diagnosis, correct medicine, correct treatment, and as a result of that, a very good result. Otherwise, you are doping sometimes in the dark. You give this medicine, kabhi, sometimes you give steroids, sometimes you give you NSAID, sometimes this thing, and keep doping. No, I have always believed make a first thing is you make a perfect diagnosis, and then you start treating the patient. You will see the impact of the whole of your philosophy of the treatment.
Right, right. Thank you, Dr. Taneja. Very, very wonderful answer. Now let's start talking a little bit about the management strategies. So, as we know that arthritis affects a wide range of age groups. So, what lifestyle modifications or preventive measures would you recommend to individuals who, let's say, reduce their risk of developing arthritis, or for people who are already developing to slow down the progression of arthritis? The question, please.
Very, very right. You see, as I've told you, let us take an osteoarthritis. The one thing is very clear that osteoarthritis is an aging process. Of course, there are now many things which are coming up. Is in a degenerative process. That as you grow, the all parts of the body will degenerate. You cannot stop it. There is no way, there is no medicine as yet which has come up which will stop the degenerative process which is going on in the articular cartilage. But of course, if you have a system by which you can reduce the loading of the articular cartilage, reduce the any injury to your joint, you will be able to slow down the degenerative process of this. Now, what is the articular cartilage? We have the chondrocytes. Now, what happens to the chondrocytes, the cells? They die. Now, these cells can die very fast. There is no medicine which can regenerate the medicine. Of course, there are lots of glucosamine and chondrocytes. They have come, which claim that they slow down the degeneration of the article. I do not know how much effective they are, but they are in the market in a big way. I have always told my patient two or three things. Number one, make sure you keep your weight well under control. Weight is a very, very important thing if are enhancing the degeneration of our articular cartilage. Now, how can you reduce weight? After the age of the 40, the weight that you put on, it's very easy to put on a few kilos, but it's very difficult even to get rid of a little bit of that weight also. So make sure you don't put on the weight. How do you do that? By controlling your diet. Most important thing, I think the why people put on the weight is their faulty diet. Two, lack of exercise. I know so many people here in Indore, they hardly do anything, no exercises. So I run a group what we label as a Jeevem Shraddha Shatam Club, that you have a right to live for 100 years. And then we teach them how do you live for 100 years. The 100 years you can only live it when you follow the law of the nature. So you have to get up early in the morning, get ready. I go for yoga. I do myself yoga, and all my people who come, 10, 15 people come, they do yoga. And the yoga, you know that it has a multifarious advantages. Multifarious advantages. It causes stretching of the capsule. It causes improves the circulation. It improves the oxygenation of the whole body, and and that is how it helps you to improve the elasticity of the muscle, the flexibility of the muscle, and as a result of this thing, that sometimes if you will even fall, these muscles will take care of this thing, and you will not have any injury to your bone and to the cartilage. So the exercise, and then walking. Walking, I don't recommend people to go on for jogging, but some people, young people, want to do jogging. I say sure, but use the grass rather than getting onto the hard surface and doing the jogging, and certainly not the running. This is very important thing to do it. And that is how once you do this thing, don't be sitting on the chair for too long a time. Now, ideally, how much you should be walking and how you should be walking. Walking is one of the finest exercise, because the God created you. God never created these all cars and scooters and bicycles. He sent you on this earth that okay, I've created you. Walk, walk, and walk. So people used to walk very long. Now this walking causes the activity of the your synovium. It gives the does the lubrication of your joint. Your muscles are all toned up. and your joints is very free to move. People, other thing people say, don't sit cross-legged, don't do the squatting, don't do the walking on the stairs. Not how can you stop them? I always challenge the people who advise such things, because most of the doctors, they are reading the Western book, and what the Western book has written, it is everything as if it is they are reading a Gita. No, in in Western world, people don't sit beyond 90 degrees of the knee joint. In our country, our social custom says that everything we have to squat, we have to sit down, we have to sit cross-legged. ये give you an example, the people you go to the villages, तो उनके यहाँ चौपाल होती है, उस चौपाल पे
Yes.
elderly लोग 70 years 80 years के लोग बैठे हुए हुक्का पी रहे होते हैं, and I have never seen patient complaining of pain in the knee joint. It's a very simple thing. So it is absolutely wrong. कि don't squat, don't sit cross-legged. In yoga we do everything. I got my TKR done, and with the TKR I sit in Vajrasan, and I do all Padmasana and other Padmasana, I do it. So this is totally, absolutely wrong. So the how much walking they should do it? It should be brisk walking. 20 minutes to half an hour is a very ideal time. And
Okay.
in the whole day, if you can walk, an elderly or senior citizen, if you can walk about 6 to 7,000 steps a day, I will be very happy with that gentleman. And I can tell you, they can carry on with their joints for a very long time. In other conditions, you see, you can ask the patient, especially in the gouty patient, to change their eating habit. In rheumatoid arthritis, you can't do except you have to tell them to keep doing exercises of the joint, not to take any tension. I have seen many patients who are rheumatoid arthritis are very tense in their family, very, very tense. They are fighting with their mother-in-law, fighting with their husband, fighting with their children, and because the stress stimulates the whatever may be the reason, autoimmune system, and they get rheumatoid arthritis. So I tell the first thing I say, get de-stressed. Don't you? There should be no need to get stressed. And third thing is avoid a very cold weather. Therefore, you have so much of rheumatoid arthritis in the cold countries, not that much in our India. Always use a nice warm water. Have sit in the sun. The three or four things which God has given to us to keep healthy, nobody uses. Number one, sun. Nobody uses. Take plenty of water, free. Nobody takes the plenty of water. Nobody takes it. Three, sit down in the garden and take a fresh oxygen. Nobody takes it. Nobody does the pranayama. And next thing I say, sit down with your friend and have a hearty laugh, and laughter will make you perfect. These four things that God has given you absolutely free of cost. Nobody uses them. And as a result of this thing, they land up into problems.
Understood. Thank you, Dr. Taneja. Very, very nicely summed up answer. Now, building on what you were talking about, you talked about the approach, a collaborative approach that a psychologist also takes. And right now, you mentioned about people not being mobile, not being able to get social. So, I want you to shed some more light on the psychosocial impact that arthritis has on people of different age groups, and how do you feel can medical communities and societies at large get together to support such patients and such individuals who are living with arthritis better? Please.
You see, Nishant, the things have a lot of water has flown through the Ganges, and there's a lot of awareness now amongst the people. Thanks to your WhatsApp group, or sometimes things are information in the WhatsApp knowledge may not be right. A lot of good interviews on the televisions by the expert. The Google gives you a lot of information. People are very, 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 very versed with this thing. Number one. Number two, so they come to the doctor and they start doing this thing. The other thing which I've said that lots of NGOs have come up in the market. I know the Arthritis Foundation of India that has come into this thing, and there is a few other organizations which has also doing into this thing, and they are trying to make the people aware. Now, I am a director of one of the very big allied health sciences institute in Indore,
Mhm.
and I have a 1,400 students who are being trained in physiotherapy, occupational therapy, and other branches. And we are starting an outreach program that our children go into the. You see, we when we talk about it, it is an unfortunate thing that our whole concentration is taking into the urban population, and we forget that there is about 65 to 70% population is still a rural population, and there are many people who live deep into the villages. There is no one to tell them what is to be done. The good part is that I have worked in a lot of tribal areas and gone into the rural area, and I found that their joints are not that bad. They for a simple reason, because they have been very lean and thin, very hard working people. They do people do a lot of walking, one village to another village, but still they have got a lot of these autoimmune problem, and such things. Awareness should be created, and physiotherapy program should be there to help them out. These NGOs have a big role, and you know that as the Arthritis Foundation International USA, millions of patients, they have helped them in educating them, and in telling them what they should do, what they should not do, and making their life very easy to live with. Because once you have a disability, you start getting homebound, and that is what where it affects your longevity, and you go into depression, and lots of other problems come. So this is very, very important that the NGOs come forward. Now here I'm telling you that we have a small groups in our community here, and whenever, because I being an orthopedic surgeon, whenever we sit together, I always tell them, look how you have to look after your joint, how you have to look after your back. We all keep talking. Then once they learn from us, they sit in other group. They say, साहब उसको ये problem था, हमने उसको बताया, उससे वो उसको बतलाता है. So this is the way then people learn what is the best for us and what is the best for this thing. And then you find the impact of these people. They come to you early, and you can deliver a good treatment to them, and they will feel very happy with that.
Right, right. Very, very rightly said, Dr. Taneja. So while we towards move towards the last part of this conversation, a few more, I would say, questions on patient awareness. So you were telling me about certain groups in your community. So how do you feel can healthcare providers and communities work together to improve arthritic care at the very grassroots level? One example is one such this virtual session that we are doing. Any more suggestions? Any more initiatives that you particularly have taken in your practice over the last years that you would like to educate everyone about, please?
Yeah, you see, I'll tell you now. In our state, Madhya Pradesh, we have one thing which we have realized, that exercise, and especially the yoga is very, very important for everybody. Now, how do you then make everybody do yoga so that they don't get into any problems later on?
Mhm.
So you will be rather surprised to know that we have a program in our state where we are going almost to reaching every house and making everybody do yoga. Anybody, so that is one our thing in which we involve the society. We go there. If there is a yoga going on, all right. If not going on there, we pick up a person, train him, and then he's giving them the yoga exercises. This thing. Number two, we have a going to different school, and we pick up the children and encourage them to do certain exercises which they do it this thing. Now these two very important things. Sometimes we have the nutritionist with us. They give the lecture on the nutrition, that what is a healthy food, what is an unhealthy food, and how you can prevent your weight and don't allow your weight to this thing. So if I see in overall scenario in our country, though we are far behind because of lack of education, and people have certain superstition in their this thing, They will not come out of their this thing. And we have found my wife has been doing a lot of work for the tribal women. They just don't want to come out and sitting in their house, don't expose themselves to sun. Lot of problem with an osteoporosis, and all these problems are coming. So I think both the doctor community, the health professionals, the allied health professionals, which includes mostly the occupational therapists and the physiotherapists, and the public at large. And beside that, there are many international organizations with whom I work. Rotary. I am the past president of the Rotary Club and a Rotary International awardee. And we do a lot of work with the Rotary. I had been going to the many African countries that volunteer. And there I used to work with many of the organizations there, which were international organizations, and where we used to do a very good educational program and awareness program. And that helped many people and not suffering that much, because if the person is going to get a rheumatoid arthritis, he will get a rheumatoid arthritis. Okay? Right.
Right. Thank you. Thank you, Dr. Taneja. One last question before we talk and close this particular session. Some common myths, misconceptions, misinformations that are there about arthritis that you'd like to bust through this particular panel of ours, please.
I don't think there are any much myths about the arthritis. The what I have my 60 years experience in the field of medicine. The most important myth is about the rheumatoid arthritis. Many people say कि साहब पता नहीं हम लोगों ने कुछ पाप किए होंगे, हमारे माँ को भी हो गया था, हमारी दादी को भी हो गया, सर ये तो अब कुछ ठीक नहीं होगी, ये तो कुछ पाप किए हुए होंगे हमारे. That is some guilt into them that they got it. Similarly, I've seen people coming to me with a lot of varus deformity in the knee joint. साहब तुम पहले क्यों नहीं आया? अरे साहब मेरी माँ का तो इससे भी खराब था, वो तो ऐसे चलते चलते ऊपर चली गई, ये तो सर भगवान की देन है, सभी को होता है. तो इस प्रकार के थोड़े बहुत मिथ लोगों के दिमाग में रहते हैं. But now people are very aware of this thing, especially thanks to the companies who have done a lot of marketing about they want to sell their joints, and obviously they cause a lot of awareness program. Don't worry, you can get almost a normal joint as possible, and there's nothing to worry about it. Previously, people thought there was no treatment. I remember my mother dying at the age of 82. She had a severe osteoarthritis. I kept saying that we'll do your TK. No, you don't do surgery on the knee joint. It's never done. No one in our family has done it. What do you want to do it? So these types of myths are there in the mind. But now things have changed a lot, Nishan. Yeah.
It's I think lovely to see that the general public is getting more and more aware about arthritis. And so I think with this, let's bring this particular session to a closure. Before we part ways, Dr. Taneja, one last take-home message that you would like to give to all of our audience, be it a patient, be it a younger demographic, be it another, let's say, a physician colleague of yours on this particular arthritis awareness. One takeaway.
Thank you so much. You see, the my message to the people at large is that one, that if you get an arthritis, don't get depressed. Today, the science has advanced so much that we have a treatment for every problem. For example, today you have a problem in your knee joint, and there are good medicines, injections, and stem cell therapy, and so many things. And one of the finest treatment is get your joint replaced. Like your tire gets worn out, you have to change your tire. It is पंचर लगा के आप बहुत दिन तक गाड़ी नहीं चला सकते, टायर बदलना पड़ता है, and you get a absolutely new tire. There's a lots of advances into the joint replacement. Two, if you get a rheumatoid arthritis, don't get this thing. I told you what you have to do it. There are lots of now good medicine and biologics which has come to this. You get any other arthritis, we got very good medicine. And always I tell my friends The worst thing in the life to happen to you is putting on the weight. You put on the weight, you reduce your life by at least 10 to 15 years. Immediately you start getting hypertension, you start getting the arthritis, you start getting spondylosis, you will start getting diabetes, then diabetes causes nephropathy, retinopathy, and then you get. Recently, I had a patient, young lady, married for about 4 or 5 years, came to me with a severe diabetic gangrene, both this limb. We did an amputation, but there was so much of septicemia that we lost it. So you see, and she was a quite an obese lady. So you see, avoid obesity, do regular exercises, live with the law of the nature, and I can tell you, you will live up to 100 years. Nobody can stop you. Jivem Sharda Shatam. That is my destiny. Pakshem Sharda Shatam, Chakshem Sharda. Nobody can stop you. How did our Rishi Munis live up to 100 years? Because they believe in the law of the nature. अभी तो क्या होता है, उसको बोलो कि ये चीज लाने का, बाहर से उतरते ही पहले अपना स्कूटर निकालता है, फिर जाके 10 गज पे जाके अपना सामान लाता है. तो क्या होगा आजकल? So much a big problem is osteoporosis.
Right.
Nobody is walking, nobody wants to do this thing. All, hey, eat the food which is cooked at home. Don't get from Zomato all this junk food. Oh, so much population is eating junk food, absolutely. So I'm very much against all these things. And I always tell that all animals in the world, this is my last thing to tell you, all animals in this world which God has created, they all live up to their age except the human being. Because the human being, according to one British biologist, you have a 1% advantage, and that 1% advantage is that your genes and genes of your monkey and ape, 99% are the same, but you have, human being has a 1% genes which are different from other people, and because of 1% advantage that you have got, you start thinking and questioning everything, that if he can fly, why I cannot fly? If he can swim, why I cannot swim? Why I cannot go to the... And you start challenging the nature. Challenging the nature. And the moment you challenge the nature, nature will take over you. Nature is the most powerful. If you want to live up to 100 years, live. Who gave you? Human being was a vegetarian, not a non-vegetarian. You never had that teeth. You never had that hydrochloric acid. Did you have it? No, you never had it. But you saw the lion killing the deer and then eating that meat. So he was had a 1% advantage. He said, "Why I can't kill the deer? Take that meat and eat." And that is how the whole thing started to come. Okay, Nishan. So live up to
Right.
100 years. Follow the law of the nature. Right.
Right. Very, very wonderful conversation, Dr. Taneja. Thank you. Thank you for taking time out and stepping up with us to create this arthritic awareness campaign that we are a part of. So, lastly, I'd like to thank Pfizer for particularly powering this session. I'd like to thank all the viewers who have engaged with us, and thank my panelists, Dr. Taneja and Dr. Gupta, who unfortunately couldn't join. He's in the OT. He just gave me a small message a while ago. So it was a pleasure connecting with Dr. Taneja, and have a good evening. Thank you.
Thank you. My pleasure.